Assalamu alaikum. Bismillahirrahmanirrahim. My name is Dr. Mahmood Shah. I am President of the Pakistan Dental Association and also Chairman of the Oral Diseases Commission of the Asia Pacific Dental Federation. As you all would be knowing that Pakistan Dental Association is the National Dental Association of Pakistan. It was formed in 1960 and since then it has flourished a lot. Currently we have more than 19 city branches in different cities of Pakistan. Pakistan Dental Association is also registered with the International Dental Federation, that is the FDI, and we are an active member of FDI and our dentists have remained office bearers of the FDI as well. Also, Pakistan Dental Association is an active member of the Asia Pacific Dental Federation also, which is the Asia Pacific regional arm of the FDI. And Alhamdulillah, Pakistan dentists have remained office bearers of the Asia Pacific Dental Federation also. In fact, currently I am also the chairman of the Oral Diseases Commission of the Asia Pacific Dental Federation. Now, that was about the background of Pakistan Dental Association, being the National Dental Association of Pakistan. Our main aim, as some dentists think that we are an administrative or a regulatory body, we are not an administrative or a regulatory body, we are a recommendatory body. We can recommend things to the government, but we cannot implement things. That is something which has to be said in the at the outset. Now, first of all, I would like to congratulate the organizers of this virtual dentistry. This is the need of the hour in these COVID days when we cannot hold physical conferences. I would like to thank and congratulate Dr. Aqib Mudassir and his competent worthy team for organizing this conference, and I welcome all the worthy distinguished speakers at this forum of 2 days of thinking and sharing experiences with dentists in Pakistan. Now, the theme for the opening day, as I understand, is growth of dentistry in Pakistan. Now, when we talk about growth of dentistry in Pakistan, so let me say that Alhamdulillah, we have since the 1960s, we have come a long way in dentistry. There was a time when I was a young dentist and there were dentists you can count on fingertips, 200 or 300 dentists. Now, Pakistan has about 30,000 dentists. In the last 2 decades, we have come a long way in dentistry. That is primarily because of the, I would say, mushroom growth of dental colleges, private dental colleges in Pakistan. This has been a blessing, a boon and a bane for dentistry in Pakistan. With the opening of these dental colleges, a lot of graduates are coming out. Now, when we talk about growth of dentistry in Pakistan, then we have two components. First is the growth of dentistry in the qualitative sense. When we talk about quality, then we also have to see that the quality has a very big quantity component attached with it. When we the quantity component is where the government sector hospitals are, when a dentist has to cater to 200 patients in a day. So I'm not going to go into detail of that because of a limitation of time. When we talk about quality of dentistry in dental clinics, of growth of dentistry in dental clinics, then Alhamdulillah, I can say that more than 90% dental clinics in Pakistan are doing a very good job and in quality control, in infection control, in cross-infection control, although there needs to be a lot more to be done, which will be, I'm sure, identified in these 2 days. The other main factor is the growth of dentistry for dentists, especially the young dentist. Now, as I see it, that because of the influx of dentists in Pakistan nowadays, unfortunately, the opportunity for growth of dentistry for the young dentist has become very limited. There was a time that a dentist could create a niche for himself in a short span of time, but now the dentist needs to really struggle hard to make a place for himself in the market. Why is that? That is because the dentist to population ratio, which we claim is like 1:25,000 or 1:30,000 in Pakistan, is misleading. That is what PDA, Pakistan Dental Association, has been saying all the time that we are mixing apples with oranges. It is not like that. In Pakistan, when we talk about the dentist to population ratio in big cities like Karachi, Lahore, Islamabad, then it may be 1:5,000, which is like the dentist to population ratio of London. But we do not have the infrastructure with London or New York may have, but we have the glut of dentists. At the same time, when we talk about the rural areas, we scarcely see a dentist there. The population there may not see a qualified dentist during their entire life. There, the population to dentist ratio may well be over 1:100,000. So that is a very paradoxical situation when we see in the Pakistani context, and that is where I feel we need to grow in dentistry in Pakistan. That is spread of dentists horizontally and not vertically in cities, and no dentists in rural areas. Why is that? Because of faulty policies of the regulatory authorities, which allow dental colleges to be open in big cities, and they apply the same yardsticks for colleges in the small cities also, which cannot be done, because you do not have a maxillofacial surgeon there, you do not have an orthodontist there, and it is very difficult for any entrepreneur to open up a rural dental college in a rural areas, considering the faculty shortage as well as the return on their investment, because setting up of dental colleges requires huge millions of rupees. So that is the area which needs to be addressed when we look at growth of dentistry in Pakistan, because when we have dental surgeons in rural areas, then again we will be going back in time like 20 years, और वहाँ पर वो dentist आराम से अपने आप को flourish कर सकते हैं. Now the situation in the urban areas, in the big cities, is not very encouraging for the young dentist, I would say, as far as the growth of dentistry for young dentists is concerned. But nothing to despair. What you need now is definitely a postgraduate qualification, which has become a norm now, which has become a must now, because without these postgraduate qualifications, simple BDS dentists cannot compete in the existing situation. With that, you need competence. That is the main bottom line factor for growth of dentists in Pakistan. If they want to grow, they have to have competence in their clinical skills. They have to adopt competencies in their clinical skills, and they have to have hard-working, dedicated approach towards dentistry. And let me say, with my 35 years of practice in dentistry in Pakistan, and with an quite considerable international exposure, that if you have these two factors, competency in your clinical work and hard work and dedication towards your work, nothing can stop you. Believe me, nothing can stop you. Your rise is guaranteed. So that is one factor for the growth of dentistry in Pakistan, as well as dentists are concerned. For the dentistry to thrive as a dental profession, the dental clinics, like I said, are doing okay, but more needs to be done. The main focus is growth and sophistication of our dental institutions in the government sector. When I say dental institutions, I do not mean the dental colleges, because dental college, the SOPs are also very well regulated because of the postgraduates who are teaching there. They are very conscientious people, and they make sure that they have all the paraphernalia, and they follow all the SOPs while performing their duties. But the government sector hospitals are lacking in this. That is the main focus which the government should be making, and I'm sure that our worthy speakers can speak about these factors also when we talk about the growth of dentistry in Pakistan. Secondly, I believe that we talk about cross infections also. I'm not going to go into that. Yes, this is the era of COVID, and hopefully COVID would be, the graph is going down in Pakistan. But even then, post-COVID situation will be very different to before what we used to practice before the COVID invasion, I would say, in all parts of the world. So let the speakers today and tomorrow delve on these situations also, and how we are going to cope on it. On behalf of Pakistan Dental Association, I once again congratulate all the office bearers of this conference, all the organizers of this conference. I wish them all the very best, and I welcome all the delegates and all the worthy speakers to this forum. With this, I thank you all, ladies and gentlemen. Allah Hafiz.